Good morning. Excuse me. I'd like to thank, first of all the members of the media that showed up today. I want to recognize, before we get started, some special guests before you, Chairman Sass and also Councilman Boykin. Thank you all for being here and supporting these efforts. I'd also like to recognize some community members: Ed Sutton, Dr. Funsell, right here, and Nancy Shipman with Wake Up Carolina. And in a few moments, you'll begin to understand the importance of these community partnerships. We're here this morning to share some information with our community that involves a seizure of an extraordinary amount of fentanyl, illicit pills, marijuana, guns, and cash that were seized on Wednesday of last week from an apartment, Folly Road Boulevard. Some of our law enforcement partners present include Chad Cook with HIDA, High Intensity Drug Trafficking, and DEA, Dan Tilton. Also present is Bryce Eichenberg from ATF, Coroner Bobby Joe O'Neill, and then Lieutenant Rouse from South Carolina Highway Patrol. And before I go into details, I want to recognize the outstanding work of the men and women of the Charleston County Sheriff's Office Warrants Division, who, through their dedication and service, were responsible for the actions that really led to this particular seizure, which is the largest seizure of pure fentanyl that our agency has seen. I'd also like to recognize, and you won't see them, members of our Metro Narcotics Task Force office, and for security reasons, we're not going to identify them, but we appreciate their efforts, and really it was their collaborative effort that helped get all this seizure secured. Additionally, I want to publicly thank members of the Charleston Police Department who were instrumental in securing the area when this was ongoing. They assisted our agency in the investigation that ensued and eventually in the capture of the individual. I'm so honored and proud to work alongside these committed individuals, and our community is safer today because of it. On Wednesday, the 19th of April, around 11 a.m., deputy sheriffs from the Charleston County Warrants Unit were executing a warrant service at number 35 Folly Road Boulevard. While at the apartment, the suspect they were seeking fled out the fourth-story balcony of the apartment and ran in an effort to evade capture. Deputies secured the residence and received information that the suspect was running through the neighborhood. Members of the Charleston Police Department, along with Charleston County Sheriff's Office, K-9 and Air Patrol, began to search for this individual. Based on the past history with this subject, and I've detailed that on a board over here so you all can see the dealings that we've had with him, but based on that, and out of an abundance of caution, it was determined that the school that was in close proximity, Porter Gowd School, was locked down as a precaution. And we were going to maintain that lockdown until we knew that the students at that school were no longer they were no longer in harm's way. A search warrant was obtained and executed on the residence at the same time that these efforts were going on for the search. These efforts involved local, state, and federal partners to locate this suspect. Then at about 6 p.m. that same day, deputies located the suspect, and after a brief encounter, he was arrested without further incident. The suspect is identified as Tyrell Javon Sistrunk. He's 27 years old. He has a history of violent crimes, including drugs and weapons, and has a history of fleeing and evading custody with law enforcement. He was out on bond each time that those occurred, and each time he was rearrested, this was no different. We have provided a timeline sort of to share with you so you understand the severity of this person's charges, who on at least 2 other occasions in the past 3 years has not had his cases heard in court. He has repeatedly been given bond only to go out and visit residents. Specifically, what you'll see is the fentanyl. It was too dangerous to bring it in here because of the potential exposure, so we have photos of that, but everything else is on the table for you all to see. I want to share with you exactly what was seized and why this is a Wake Up Carolina moment in Charleston. The seizure of fentanyl powder is about 2.5 pounds. We have over 600 pills that were seized individually. A pill press, 2.5 pounds of marijuana, an AK-style rifle, 2 handguns, and over $7,700 in cash. The potency of fentanyl, which is, by the way, a synthetic heroin. It's a form of synthetic heroin. It's very inexpensive to manufacture. The potency can't be undermined. This single seizure of fentanyl, this 2.5 pounds, is enough fentanyl to provide a lethal dose to every person in the city and county of Charleston and Colleton County. And add another 50,000 people to that. That's how big the seizure was, and that's how important this is to this community. I want to repeat that. This single seizure of fentanyl, 2.5 pounds, is enough fentanyl to provide a lethal dose to every person in Charleston City, County, and Colleton County, plus 50,000 people. The DEA says that a kilo of fentanyl can kill over 500,000 people in a lethal dose, if a lethal dose is given. Our country is in the midst of a public health, public safety crisis involving opioid addiction. I think that is not new to folks, but I think you need to realize that Charleston is not immune. We're not immune to this crisis. This operation that was uncovered by law enforcement is a clear sign that we are clearly not immune to this. In February, I met with the DEA Director, Ann Milgram, about this crisis. And she stated that fentanyl is the single deadliest threat to our nation has ever encountered. Fentanyl is everywhere. From large metropolitan areas to rural America, no community is safe from this poison. We must take every opportunity to spread the word to prevent fentanyl-related overdose death and poisoning that's claiming thousands of American lives every year. It's fentanyl, what you see in these bags is 50 times more potent than heroin and 100 times stronger than morphine. With the new introduction of xylazine, or what is referred to as tranq, it's a tranquilizer into fentanyl, we're beginning to see here locally and in the state, we will have less better outcomes with reversing the effects of fentanyl. Because Narcan, which is typically used for that, is not effective in reversing the effects and is not responsive to xylazine or tranq, and guaranteeing almost certain death in many cases. Our coroner's office and their staff, along with law enforcement, encounter this threat daily. Daily. We're seeing this every single day in Charleston County. And I want to thank Coroner Bobby Joe O'Neill for being here and being engaged with us in this very real threat. If you are not prescribed a medication approved by the FDA and pick it up at a pharmacy, you're probably 100 times more likely to be getting something laced with fentanyl, and you're susceptible to overdose. The U.S. Department of Health and Human Services issued a public health alert, and it said the U.S. is in the midst of an opioid overdose epidemic. If you or someone you know needs help, effective treatment is available and can save lives. In Charleston, effective treatment is available. So I want to highlight the importance of getting help for anyone you know who may be suffering from. We'll post the numbers and the links to make sure that we get them out to folks that need help. If you suspect someone or you know someone, please reach out. Please use these resources. Effective treatment available and save lives. We stand here before you today to assure you that as law enforcement and all of our law enforcement partners present and those that could not make it, we will continually and aggressively pursue persons that are distributing this poison in our communities. We and our law enforcement partners are committed to arresting and prosecuting anyone in the community that puts our citizens and our residents at risk. And at this time, I'd like to introduce Dr. Shonda Funsell from Charleston Center, Deotis program, and also Nancy Shipman with Wake Up Carolina to talk to you a little bit about what help is available.
Good morning. Thank you, Sheriff, and thank you, team, working so well together to get fentanyl off the streets. It's so important that we address this opioid epidemic aggressively in this community. County is significantly impacted by the opioid epidemic and overdoses. The overdoses have increased 25% from the previous year and is on target for increasing at an even higher rate in the year coming. Monitoring overdose communities, significant number of people are impacted, families, loved ones, friends, relatives, all know somebody who has recently died from an overdose or impacted by the opioid epidemic. Treatments available. It's so important to take a multi-pronged approach to attacking this epidemic. So through seizure efforts, through prevention, harm reduction efforts, increasing awareness about opioid overdoses and opioid use disorders, getting Narcan and fentanyl test strips out in the community, and treatment, all of those can help reduce the negative impact of opioid community. At the Charleston Center, which is part of Charleston County government, we have a full continuum of care from detox to residential services, outpatient services, medication-assisted treatment, services specifically for women and people experiencing trauma, as well as therapeutic child treatment programs. And we work collaboratively with a number of partners in our community to do overdose follow-ups. We work closely, including our fire, EMS, and law enforcement. And this important partnership helps protect our community and help to collaboratively attack this awful in our community. And some of our key partners include our community recovery services, and one of those important partners includes Wake Up Carolina, and I'm going to Nancy Shipman so she can talk about what she does in her program. Thank you.
I'm Nancy Stedman Shipman with Wake Up Carolina. The time is now. We receive calls to count on a daily basis, emails, and Instagram messages. People are in dire need of and families are desperate for support for themselves, whether their loved one is interested in treatment or whether their loved one is no longer here. Onto that category, I lost my son to an overdose in 2016, and that's what founded our nonprofit relies on community partners. We cannot do it ourselves. It takes that multi-pronged approach that Dr. Funsell shared. It is crucial that as an individual that is seeking or seeking, as well as a family member, also treatment. This is a community disease and recovery, starting right with yourselves. If you know something to say, we are here, no judgment, and we help connect you with appropriate services and support services and treatment. I just can't say enough how crucial this arrest was. Saved so many. It's one less family that has to go through the grief process, and it's one less individual that can live. This is important work, and I'd like the sheriff's office.
I'm going to introduce our coordinator, O'Neill.
Some numbers to the tragedy here in Charleston County. I've been speaking to you about the number of overdoses that are occurring and so in 2021, 183 drug overdoses in Charleston County. Most of those related to 2022, that number skyrocketed to 104. We get for 2020 that number 40 cases positive for
an opioid substance disorder, that this is available to them, that it gets used immediately, and that they do not become a part of the coroner's statistics. Where can you get these? I can tell you that the coroner's office has become a distributor within our community. You can come to the coroner's office. We will give them to you, no questions asked. But our goal is to make sure that Narcan is used and that they have an opportunity to then receive treatment here in our community where we have treatment available. So I thank you for your time. This seizure is hugely important for our county. It's also important for our neighbors. Opioids and drug abuse does not know county lines. It's crossing into Berkeley County, into Dorchester County, and into our neighbors. And so any seizure that we can get here in Charleston County is saving lives not only here in our community, but our neighbors. And with that, I'm glad to answer any questions, and I'm sure the sheriff would answer any additional questions that she may have. Thank you. Don't record that.
Any questions?
Yes, I'm curious as to how does someone even get this much fentanyl? Like for one person, where does that all come from? Because clearly this person was selling it, putting it in a bunch of stuff. How does one person get this much for themselves?
Well, the illicit drug trade. I mean, that's what's happening in our community. We were talking earlier with members of the DEA and how people say it's the border states. It's the border state. Every state's a border state right now. It's everywhere.
I have a question. Can you say has any fatal fentanyl overdose been linked to this individual seller?
Well, I'm not aware of any as of yet. This investigation is still ongoing. Any other questions? I thank you all so much for being here. We appreciate your time, and this is so important to get this message out to our community. We will post on our social media. Bobby Jo, do you have a way to post on your social media? Help?
Yes.
Yeah, and then I know the Charleston Center has access to Narcan. The jail distributes Narcan locally, and now you just heard the coroner's office. We're happy to get that to folks that need it. Please reach out, and we'll make sure you get some. Thank you.